joining me on the Slice of Healthcare podcast. I'm your host, Jared Taylor. Today's guest is Katie DiPerna Cook, the SVP of Partnerships at Headspace Health. Katie, how are you today?
I'm doing great. Thanks so much for having me.
I'm pumped to have you on. You're the first guest where I have the new hats too. Look at this.
I love it. So I
Um,
noticed that when you first came on.
yeah,
I might
it's
put
and
these back.
if anyone's watching this, it is not to the side. It's the way the camera angle is. It is perfectly straight. Anyway, so excited to have you on here. You and I had the opportunity of meeting at the ATA conference in Boston recently. We did a little teaser video, which was a ton of fun. Um, and what's it called? Now we get to do the podcast finally. So this is very exciting.
Love it. Very exciting.
Would love to dive right into it. If you could tell the audience a little bit about your background, and then we'll go from there.
Yeah, sounds great. Again, thanks so much for having me. Excited to be here and share a little bit about what we've been up to. As Jared mentioned, I lead our partnerships for Headspace Health. So think of that as all of our healthcare partners, payers, providers, essentially anywhere where we are looking to partner with an organization to reach members at scale. And so prior to the merger, I came from the Ginger side. I was in a very similar role at Ginger. And then previously, before I came to Ginger, I spent the better part of the past decade at Evolent Health. Really kind of grew up through the organization in a variety of different roles. I was one of the early employees, but really spent the bulk of my time working closely with payers and providers in a range of value-based contracts. So that's kind of what brought me to today.
And today you're at Headspace Health. Tell us, we focus on three things. So tell us the why, how, what of Headspace Health, assuming no one's ever heard of it, but everyone should already know of it. That would be amazing to hear that.
Yeah, sounds good. Sounds great. Starting with why. As I mentioned in the sort of teaser video that we did together, mental health is health. It impacts how you eat, how you sleep, exercise, how you take care of chronic conditions that you may have, how you work, your productivity. So much goes back to mental health. And yet, so many people either don't access care, can't access care, or don't know how to treat a mental health condition. And I think that Headspace Health, the why behind Headspace Health is to really break down all of those barriers and to really think about mental health as part of your physical health, and to create just an engaging and powerful virtual platform, um, as well as a multidisciplinary model that can really meet people where they are, engage people day to day, make taking care of your mental health a part of everybody's day to day. And that's a lot of the sort of why behind the concept of Headspace Health. Um, when I think about how are we doing it? The idea, and again, if I think about somebody who doesn't know anything about Headspace Health is the parent company of Headspace and Ginger, which merged last fall. Headspace being the incredible app focused on meditation and mindfulness and self-directed care and content, merging with Ginger, which provides a multidisciplinary mental health care, both coaching, therapy, and psychiatry, bringing that together all in one platform and using sort of coaching and content as a really engaging front door to bring people in, to get people faster access. Through Headspace Health's Ginger coaches, people can get access and be texting with a coach within 2 minutes. And so it's just a really incredible platform to get people engaged in their health and then also help navigate them to the right level of care at the right time. And that's really sort of the how around what we're doing, is creating this full spectrum of mental health care all in one platform. And then the what, or maybe if I think about it as sort of what's next as well, I think it's taking this sort of scalable, engaging platform, and thinking about how we really integrate within the healthcare ecosystem. If we want to be able to say we're providing a full spectrum of services to treat mental health conditions, that includes engaging with payers and providers and meeting people, where they're accessing healthcare as well. But a big part of being a part of the healthcare system is being able to track outcomes and, not just engage people, but really get people better. Are we really truly improving mental health in this model? And I think that that's really what I'm excited about as we think about the what next is, tracking outcomes and not just tracking them, but also starting to look at sort of payment models and, think about how we get paid for outcomes. And so then that's where we as Headspace Health can really, continue to be disruptive, both in how we're accessing and getting people into care, but then also how mental health care is being paid for.
Love it. Yeah, we had the opportunity, or I didn't, but one of our other shows, Decoding Healthcare Innovation, had Russ Glass on. I think it was a couple months back now. It might have been towards like the mid to later part of last year. Um, so it was great being able to have him on as well. And then obviously you and I have been connected since the conference, and it's always great we can bring people from the same organization to on the podcast because you have different perspectives, but you're also able to tell us something new about the company that
Yeah.
we didn't know or we didn't hear before. I'd like to kind of shift focus now and go into some of the key topics here today, and one of which is around like where we're at today in terms of behavioral digital health, um, specifically around digital adoption. So, would you say we're at a turning point right now, or what are your thoughts on kind of where we're at this point?
Yeah, I do think we're really at a turning point right now, and for a couple of reasons. One, I think the COVID obviously put a significant accelerator on the use of virtual tools across the entire healthcare spectrum, but including in mental health. It also, worsened the need for mental health care and made the access problem even worse. And so I feel really strongly that the virtual mental health tools are not meant to replace in-person care, but really meant to create a scalable platform that engages people earlier and often in mental health care so that we aren't just treating people when they're in crisis, but that people think about mental health care as a part of their everyday life. And what's more a part of your everyday life than your smartphone? And so, really being able to use those tools that are just in everybody's hands and getting people engaged in content, engaged in coaching, and then navigated to the right care in that virtual setting. I think we've got a huge opportunity to treat a large portion of sort of outpatient treatable mental health conditions for people who otherwise wouldn't access care or wouldn't access care until they're in crisis.
Yeah, it's certainly interesting. There was a lot of companies that kind of moved into the space, some of which are doing some great things, some of which have definitely been in a different light as of recently, right? It's great to hear how you and your organization are operating and the area that you're going towards. I think this is a really interesting space. I think the space that you're in for digital health, this is like the best area. This is the best use case for what this technology was designed for. Um, I feel like we're hopefully getting out of that phase where people are, in the early stages of a certain space where everyone's coming up with all these different ideas. Like crypto went through it, right? Where it's like, you're in the good spot. So it's great to
Money
hear.
train
Yeah.
capability.
Um, in terms of like, are you seeing an increased interest in digital mental health, like by the health plans in particular? And basically, let's also talk about. So, are you seeing it with the health plans, but are you also seeing it with the employers as well? This interest.
Absolutely. We see this as the largest and fastest growing part of our business. Is really through accessing those channels through employers and plans. I think there's a couple of reasons for that. I mean, first of all, particularly from the plan perspective, um, there's a couple reasons. You know, the plans are looking for ways to engage people in their mental health care, open up, create more engagement within their platforms. And you know, we've seen Headspace as a brand as an incredibly engaging way to get people in to the system, to get people using platforms, using their benefits, which then again gets them to the right level of care. I think too, the access crisis is hitting payers as well and employers. You know, when I'm out talking to employers and payers, the first thing I hear is it takes too long for my members or my employees to get access to a therapist. There's no way without disruption in the system and using virtual tools that plans or employers are going to be able to provide the access that is needed for their employees. We've got to figure out the supply demand imbalance model, and again, creating that sort of using the coaching model, using a multidisciplinary care model that uh, uh, you know, can deliver, you know, very similar outcomes, is a key access point for plans and a key differentiator. um, and then lastly, I think from the plan perspective, we're really seeing a lot of opportunity here given the close relationship between payers and employers, that if we can integrate with payers similar to our relationship with Cigna, we have a large strategic relationship with Cigna, where Cigna employer groups, their employees can actually access Ginger coaching and therapy and psychiatry as a covered benefit. And they can also purchase enhanced access or, you know, purchase access for their entire populations through Cigna, which just creates an easier purchase point for employers who are being, you know, obviously flooded with a lot of different opportunities, and again, it just sort of further extends that full spectrum platform.
Interesting. Yeah, it's I wouldn't have thought there wouldn't be interest from both the payers and the employers, but I still wanted to ask, and you said it so eloquently. So thank you for giving us that take. Um, let's talk a little bit about how Headspace Health came to be. So back in I believe it was August of
Mhm.
2021. So almost been a year now, right?
Yep,
Um,
few
Ginger
months.
merged with Headspace to create Headspace Health. So, can you share a little bit, I guess, over the year since that merger happened, what kind of integrations have taken place between the two companies?
Absolutely. It's been an interesting year. And mergers are always complicated and difficult, and also create such opportunity both for employees as well as the offering that we can take to the market. And I think for me, what's most exciting again is I'm out talking to payers and providers when I talk about Headspace Health and bringing together these two incredible platforms into one, you know, one entity. Immediately people understand and get what we're doing, which to me feels like the thesis of the merger is incredibly powerful for employers and payers. I think from an integration standpoint, we made a ton of progress. I will say this year, we've been really focused on making sure that we're delivering on our commitments to existing partners, and employers. So, you know, both from my world, we're implementing some large partnerships this year. So we've stayed focused on making sure we see those through, while doing the planning for a fully integrated product. So I'd say, you know, this year, focus on integrating teams, building the business, creating the vision for where we want to go as a company, and while delivering on existing commitments. I think in the back half of this year, we're going to start to roll out some more connected experiences between Headspace and Ginger, which I'm super excited for. You know, things like unified front door, integrating reporting. And then as we, you know, can go into next year and beyond, you know, we'll look to create, you know, sort of that one home of mental health services that again creates sort of a very um, easy to access, approachable platform that's both easy for employers and payers to purchase, but most importantly, um, easy for members to use and access on a regular basis.
It's so exciting. I'm pumped, and I hope we can have you come back on to when these announcements are coming into play to give us the highlights
I
of
would love
what's
to.
new. Awesome.
Absolutely. Absolutely. Would love to.
I'm excited. By the way, I always say this, and people probably scratch their heads and why I even care, but love the colors, love the brand. I had to say it.
Oh,
Um,
love it.
had to. I like orange. My first car was orange, actually. It is like an orangey color, right?
That's right. That's
Okay.
right. It's so it's very powerful. Also, my 7-year-old daughter's favorite color has been orange since she was 2 years old, and so she thinks that our brand is orange because it's her favorite color.
Hey, it's tell her that's the case. That's, I mean,
Yeah.
Steve Jobs named something. What was it, after his daughter? But he told her the opposite. He told her it wasn't about her or something like that. Um, um, so yeah, don't do that. Don't yeah, you're doing it the right way.
Right. I'll let her leave.
Well, so I have a few more things before we wrap up, but like maybe two more quick questions for you. Um, so how do you manage the range of both low to high acuity cases within your range of services, and then also, in your view, can all mental health care be done virtually? And then if you want to add like at this time, or if not, what's your outlook on the future of mental health care that we get there?
Yeah, good question. So I think when we think about the severity of the patients that we treat, what what really makes me feel like we've got an incredible opportunity to help address that sort of supply demand imbalance, that there's just not enough therapists and psychiatrists to treat all the people who need to access mental health care. Where we see such an opportunity is in that mild to moderate category, for individuals who, um, not everybody needs somebody to talk to, but not necessarily everybody needs to see a therapist. And what we've been able to show in our outcomes is that when you look at that mild to moderate population, we are seeing similar outcomes for a cohort of patients that just worked with our coaches through our text-based coaching model, as we do again with this sort of mild to moderate population that worked with a therapist. Very similar results in how they improved their PHQ and GAD scores in those two cohorts. And so to me, that gives me a lot of optimism around we can treat those people in a virtual setting and in a multidisciplinary setting while reserving the capacity, the therapy and psychiatry capacity, both virtually. We certainly provide therapy and psychiatry to many members who may come into coaching, but we realize need to escalate and need a higher level of care or at a higher level of severity. So, but again, it's reserving that therapy and psychiatry capacity for those who need it most, whether that's in a virtual setting or in an in-person setting. And then to answer your question about will we always be virtual, will we ever be a world where mental health is all virtual? If I had to stare into a crystal ball, I would say no. I don't see virtual as replacing in-person care and inpatient care. There are needs that are more severe than can be treated in this setting. And I think to truly hold ourselves to high clinical standards, I don't think that we can say that we can treat all conditions. But the value is two pieces, I would say. One, we can reserve that capacity for people who really need it by treating people virtually who can get better in our model. And then two, I think this is really important where our push to be a part of the healthcare ecosystem is so important for those people who need higher levels of care. When we partner, with a Cigna or with a provider, we have somewhere where we can hand them off to and they can have access through their broader network. as opposed to us creating fragmentation in the system by being virtual. And that's why when I think about the full spectrum of care, I do think that those being a part of the healthcare ecosystem is so important.
Absolutely. Yeah, I always say the future is hybrid. Um, it can't just be totally virtual. I think it'll be majority virtual, but I think that if without the hybrid, it doesn't work.
That's
Um,
right.
really
And
cool.
we got to make sure that we set it up in a way that we don't create more fragmentation for these members who really need to access care.
Boom.
Um,
That's it right there. Love it. Last thing before we leave, you have any conferences coming up the rest of the year that you're attending, or what is that looking
yes,
like?
we will definitely. We were just at AHIP last week, which was a great experience. Got to meet with a lot of plans. A lot of our existing partners were there as well, so that was a great event, good experience. And then we'll definitely be at Health, which I believe is in November later this year. So hopefully,
Cool.
maybe we'll see you there.
I will be there, and I'm gonna try some new camera moves for some transitions and stuff. You'll see. It's gonna be fun.
I'm looking forward
Um,
to it.
yeah, it's gonna be fun. It's in Vegas.
I know, I know. Big change from Boston last year, so look
Yeah,
forward to
it's good
that.
for the people, but it might also draw a different crowd because now more
Yep,
whenever it goes to the different coasts, right? More people on a certain coast will end up attending. So we saw a lot of people on the East Coast. Now we'll see more people on the West Coast go. Um,
absolutely.
awesome, awesome. All right, so great talking with you as always, Katie. Can't wait for our next conversation and very exciting stuff.
Likewise. Well, thanks again for having me on and for the time, and I look forward to continuing the conversation.